Do your eyes ever feel like they're on fire by the end of the day? Burning, irritated, and exhausted, even though you haven't done anything unusual? Welcome back to Eye Health Insights. I'm Dr. Joseph King, and today we're talking about burning eyes, what causes that uncomfortable sensation, why it's so common in modern life, and what you can do to finally get relief. Here's what we'll cover today. The most common reasons eyes burn, how to tell if it's dryness, allergy, or something more serious, practical treatment options, and when burning is a sign that you should be evaluated. Let's start with this. Burning is one of the most common eye symptoms I hear about, and in most cases, it's not dangerous, but it is disruptive. It affects focus, comfort, productivity, and even your mood. So what does burning actually mean? Burning is typically a surface symptom. It usually tells us that the front layer of the eye, the tear film and the cornea, is irritated. And the number one cause of that irritation is dry eye. Your eyes rely on a very thin, balanced tear film. Every time you blink, you spread tears across the surface to keep it smooth and comfortable. But when that tear film becomes unstable, either because you're not producing enough tears or they're evaporating too quickly, the surface becomes inflamed. That inflammation creates the burning sensation. One of the biggest contributors today is screen time. When we look at computers, phones, or tablets, our blink rate drops dramatically. Normally, we blink about 15 to 20 times per minute. On a screen, that can drop to 5 to 6 blinks per minute. Less blinking means less tear distribution and more evaporation. The result? Burning, dryness, fluctuating vision, and sometimes even reflex tearing. And that reflex tearing can be confusing. Patients will tell me, "My eyes burn, but they're also watering." That happens because irritated eyes send a distress signal to produce more tears. But those tears are mostly watery and they don't have the proper oil balance, so they don't fix the underlying dryness. Another common cause of burning eyes is blepharitis. Blepharitis is inflammation of the eyelid margins. Along your eyelid margins are tiny oil glands called meibomian glands. Their job is to produce the oily layer of your tears, which prevents evaporation. If those glands become clogged or inflamed, your tears evaporate too quickly and burning develops. Allergies are another major contributor. If your burning is accompanied by itching, redness, and puffiness, especially during certain seasons or around pets, allergies may be playing a role. In allergic eye conditions, the immune system overreacts to environmental triggers like pollen or dust, leading to inflammation and that uncomfortable burning sensation. Environmental factors matter too. Dry climates, air conditioning, indoor heating, smoke exposure, and wind can all increase tear evaporation. Even sitting under a ceiling fan for long periods can dry out your eyes. Contact lenses can also contribute. If lenses don't fit properly, if they're worn too long, or they aren't cleaned well, they can disrupt the tear film and cause irritation and burning. Think of a contact lens as a sponge. It sucks up the tears, and that can aggravate dryness of the eyes. Sometimes the eye is simply telling you it needs a break from the contact lenses. Now let's talk about when burning might signal something more serious. Burning alone, without vision changes, is most often related to surface irritation. But if burning is combined with significant pain, light sensitivity, discharge, or decreased vision, that's different. Infections of the cornea, known as keratitis, can sometimes begin with burning before progressing to more severe symptoms. Chemical exposures, even from household cleaners or swimming pool chlorine, can also cause intense burning and require immediate rinsing and evaluation. So how do you approach treatment? Well, the first step for most patients is lubrication. Preservative-free artificial tears can help stabilize the tear film and calm inflammation. If you're using drops more than 4 to 6 times daily, preservative-free options are especially important to avoid further irritation. Warm compresses can be extremely helpful, especially if meibomian gland dysfunction is contributing. Applying gentle heat to the eyelids for 5 to 10 minutes helps liquefy the oils and improve tear stability. If allergies are involved, antihistamine or mast cell stabilizer eye drops may reduce inflammation and itching. But it's important to use targeted allergy drops rather than general redness relief drops, which can sometimes worsen irritation over time. Environmental adjustments can make a big difference. Using a humidifier, positioning computer screens slightly below eye level, taking blinking breaks, and following the 20-20 rule, every 20 minutes look 20 feet away for 20 seconds, can significantly reduce symptoms. From a patient perspective, burning eyes can feel frustrating because it often builds gradually. By the end of the day, your eyes feel tired, irritated, and sensitive, and you may not even realize how much screen time or environmental dryness contributed. The reassuring part is this: in most cases, burning eyes are manageable. Once we identify the underlying cause, whether it's dryness, eyelid inflammation, allergy, or environmental stress, we can create a plan that brings meaningful relief. But don't ignore persistent symptoms. If burning lasts more than a few days despite using artificial tears, or if it's accompanied by vision changes, significant discomfort, or discharge, it's worth scheduling an eye exam. Chronic inflammation can affect the surface health of your eyes over time. Your eyes are incredibly resilient, but they rely on a stable tear film to stay comfortable and clear. Burning is often your body's way of telling you that the balance has been disrupted. If your eyes feel like they're constantly irritated or on fire, don't just push through it. A simple evaluation and a tailored treatment plan can make a dramatic difference in your daily comfort. If lubrication of the eyes alone and the use of warm compresses does not provide satisfactory relief for a patient, there are multiple therapies that are available, and it's important that you see your eye doctor to help you come up with a tailored treatment plan to help your symptoms become resolved. Thank you for watching Eye Health Insights. Take care, and we'll see you soon.